Hi, I'm Dr. Dan Casasilla. I'm a board-certified neurologist practicing in Sarasota, Florida.
The NFL, National Football League, and Major League Baseball use this as one of the prime therapies for their star and treasured athletes for treating joint injuries to get them back into the game, whether it be the Super Bowl or any of the series games. They use PRP in these highly paid, very excellent athletes to inject their shoulders, like in a pitcher for the shoulder and the elbow for elbow injuries. In the NFL for the linebackers or their wide receivers or any of their players. Really, knee injuries are very common, shoulder injuries are common, and if they don't have a mandatorily surgically treatable problem, PRP is probably the safest, most effective, rapid way of getting that star athlete back into the game, because again, after the PRP injection, now, they do have rehabilitation because they have very intensive training and rehabilitation. But with PRP therapy, 6 weeks and that's it. The healing is done by 6 weeks, whereas if you have surgery, you're looking at a 3 to 6 months rehabilitation. And the vast majority of the patients report either a significant reduction in pain or their pain is gone within 1 to 2 weeks. That doesn't mean the healing process is stopped, though. Again, that continues on naturally. It's a natural healing process. It's the body's own healing process that goes on for 6 weeks. But it's very interesting that you asked that about the knee, because the cartilage in the knee and the knee joint itself, and particularly cartilage, however, has a very poor blood supply. Normally, that's just that cartilage doesn't have much in the way of blood supply. So that's why torn cartilages in the knees take so long to heal, and even the ligaments and tendons, the blood supply in the knee is not that great. Just all of us have that. It's natural, it's normal. And what PRP does is not only does it lay down new tissue, it's really interesting, platelet-rich plasma, the components of PRP go in and attach, they seek out damaged tissue. So it goes in, the cells, the healing cells, which are the platelets, go in and attach to damaged tissue, then they release growth factors, and it also releases angiogenic factors, which create new blood vessel supply. So not only do you get new cartilage and new tendon or ligament tissue laid down because stem cells come in and then differentiate into whatever tissue they need to be, but you also have angiogenic growth factors, which mean blood translates into blood vessel growth factors. So you actually have growth of new blood vessels. So it's creating or it's forcing new blood vessel growth to go into the damaged tissue area. So you're getting new blood supply in an area that previously didn't have any blood supply. So that's the miracle of PRP. The other thing is about PRP is the body doesn't have the ability to concentrate its own healing components in the blood. The blood's just circulating around in the body, but we can, with a special machine in the laboratory, we can, right here in the office, we can concentrate that healing tissue in the blood and then inject it right into the area that needs that really concentrated, intense healing. We concentrate up the healing component of blood by 500%, and sometimes even a little bit greater than that, up to 700 or 800%, and then we can inject that right in the area that needs concentrated blood healing tissue, which is the PRP. PRP therapy is in an area of medicine called regenerative medicine, and the reason it's called regenerative medicine is we are regenerating new, healthy, stronger tissue than it was before. So again, when I say tissue, it could be tendon, ligament, cartilage, muscle, doesn't matter, wherever the PRP is injected, and again we get stem cells coming in there, and the stem cells can differentiate into any kind of tissue that they need to be. So the PRP has recruitment factors in it and growth factors that actually they're chemical messengers that cause stem cells to migrate into the area, and the stem cells then differentiate into tendon, ligament, cartilage, muscle, or blood vessel, whatever they need to differentiate into. So it is truly remarkable therapy.
I'm looking forward to meeting you and helping you with your neurological problem. Pick up the phone now and call 955-5858 to schedule your appointment.